Hello, my name is Vincent Creel and I'm the Public Affairs Manager for the City of Biloxi. This is today's Be Prepared report and it is being recorded on Wednesday, May 13th, 2020 at 1:15 in the afternoon. Today we're going to have some interesting insight from two leaders in the community. We'll hear from Tom McDougal, the CEO of Merit Health, about Biloxi's healthcare status and if we are on the backside of the first wave of the coronavirus. We'll also hear from Major Bradley Caldwell of the Salvation Army of the Gulf Coast. But first, the numbers. Mississippi has now seen more than 10,000 coronavirus cases, according to the Mississippi State Department of Health. In the past 24 hours, 182 cases have been reported statewide, pushing the overall total to 10,090 cases. There have also been 8 deaths in the past 24 hours, pushing that total to 465. Here's the overall chart going back to the beginning. And here's the 14-day trend on statewide cases. In Harrison County, 9 cases were reported in the past 24 hours. Here is the 14-day tracking chart for Harrison County. In Hancock County, 1 new case was reported in the past 24 hours and 2 new cases in Jackson County. Mayor Andrew Fofo Gilich today will be meeting with representatives of social and fraternal groups. Groups such as the VFW, the Elks Lodge, the Slavonian Lodge, and the French Club were temporarily shuttered by the governor some time ago. The mayor is not looking to prematurely open anything. What he wants to do is make sure that everyone is aware of the safety guidelines when the governor gives the okay. It's the same thing that the mayor did with retailers, restaurateurs, attractions, and a host of others. He wants to make sure that safety is first. He also wants to have similar meetings soon with museums and those looking to do summer camps. And now this. Joining me now is Tom McDougal, the Chief Executive Officer at Merit Health in Biloxi. Tom, thank you for joining us.
Thank you for having me.
What's been happening over at Merit? I know that y'all have taken a number of measures at the outset of this. What were those measures and how have they changed?
Yes, we did make a lot of adjustments to the way we were handling patients coming in the facility as well as visitors and our staff. We're continuing many of those measures and have even expanded those. Currently, we've restarted surgeries, restarted our outpatient procedures, so we've expanded our social distancing efforts because now we have more and more people that are in the facility.
If I wanted to go visit someone in the hospital, is that possible?
Yes, absolutely it is. We just do it on a very limited basis. We're limiting to only 1 visitor at a time, and it has to be a healthy adult. But we have expanded that to create those opportunities.
I should also say that one of the reasons we wanted you over here, and we appreciate you taking the time to come over.
Absolutely.
This is National Hospital Week.
It is.
That must be something that is a chance for y'all to let your people know how much you appreciate them.
It certainly is. And I've adopted the phrase from the Southeastern Conference. I'm a big football fan, and their phrase is, it just means more. And this year, we just feel like Hospital Week means more to everyone in the community because of the outpouring of support that our staff has seen and how much we appreciate them. The most interesting thing to me is that the number of times that different organizations or politicians or different groups have called our staff healthcare heroes, and I smile whenever I hear that because I already knew they were healthcare heroes. But it's certainly nice to have those outside of our organization recognizing them. I'm just so proud of them.
Give people an idea of just how big your staff is.
We have about 600 employees and about 230 physicians on our medical staff. So we're a pretty big operation.
One of the things that people have been told over and over and over is to stay home and to try to distance yourself from others. Don't go out in public. Is that scaring people from going to the hospital or going to see their doctor? Is that a concern of yours?
Yes, it really is. There's been research out there showing that about 1/3 of Americans are afraid to go get care in a healthcare setting. It's actually kind of interesting because the extent we've gone in terms of protecting everyone. We like to refer to our facility as the COVID safe hospital because we put in so many precautions to make sure people are safe and that our staff is safe. But this fear they actually are more at risk going through a drive-through at a restaurant. I'm not discouraging that, because
Right.
I do want everyone to support local businesses as much as we can, but the measures we've gone to are so much more extreme than that. They're safe coming to our facility. The bigger concern we have is that we're seeing indications that Americans are delaying care. So for example, if I were to be having, I wake up one morning and I'm starting to have tightness in my chest and some chest pain, that could be early warning signs of a heart attack. And we're seeing research and data out there that patients are not coming to the emergency department to get checked out. And we've seen support of that in our facility as well, that patients that are presenting to our facility, they're sick because they've been at home and they've been ignoring some of these concerns. And I just want everybody to know that I believe in my heart, because of all the things we've done to be safe for you as a community and as for a group of patients, that it is safe to go see your physician. It's safe to come to the emergency department. We're going to look out for you. We're going to care for you. We did an amazing job. Our staff, I'm so proud of them. We had no COVID deaths. We have not had a positive COVID patient admitted to our facility in over a month now. We never had any staff members or physicians test positive for COVID. And that's amazing that we did that all through the peak of the COVID pandemic. But what people should know is that based on that performance, what our team was able to accomplish during the peak, they are certainly safe now to come see us. And so I just want to encourage everyone, look out for your health. Do what's in your best interest.
That's got to be
delaying care is scary to me.
That's got to be number one.
It really is.
You said something that caught my attention just now, and you said all through the peak. Do you
Yes.
think we've seen a peak?
We definitely saw a peak. The peak along the coast seemed to occur really about 60 days ago to 30 days ago.
So you would say that we're on the back end of this?
I believe we are on this side of the state. Now, there are certain sections of the state that are still experiencing rising or high numbers. But down here on the coast, things have really begun to slow down. I was talking with one of our infectious disease physicians this morning, and he confirmed that it's not just our facility, it's all facilities along the coast seem to be slowing a little bit with the initial surge that we saw of COVID patients. And everybody's seen on TV and hearing Dr. Fauci or others, and they've talked about this curve that we saw. And we saw the curve earlier here in the state of Mississippi than other parts of the state saw that curve. So we're also on the downside of that curve earlier than other parts of the state. Now, could we have a resurgence? Could we have a second peak? Could we have a third peak? Certainly that is a possibility, but all of the models are saying that may very well happen in the fall or next winter. We're not anticipating a secondary peak coming in the next couple of months.
Do you worry about fatigue? And I'm talking about not your doctors or your staff getting tired. I'm talking about the kind of fatigue that we see with hurricanes, where people say, well, you know what, I evacuated like you told me to and nothing happened. Do you worry about people letting their guard down and not being as vigilant?
That is a definite concern, and it is a balancing act. I think the last time you had me, my hair was not quite as long as it is now. I'm getting a haircut today. I'm so happy that the barbershops are opening back up. I think as Americans, we've reached this point where maybe now our biases have shifted some, because initially there was an enormous amount of fear because we didn't know what we were facing. Now that we're coming kind of on the back side of this first curve, we're starting to realize, well, I knew someone who had COVID and they're fine. Or nobody in my family was tested positive for COVID. So maybe it wasn't as bad as we thought it was going to be. So our biases have changed a little bit. With that comes greater comfort. You get to a point where maybe the fear is reduced, but it also causes us not to be as vigilant as we need to be. What I would encourage everyone to do is really self-assessment. Make good decisions. Don't do things that are going to put you at risk, or if you are in a health condition where maybe your immune system is compromised because of another medical condition, they need to be essentially careful. Those of us that are healthy, then maybe we can go ahead and start going back to some of the normal things, but be very sensitive and aware. I mean, certainly, when I walked in and saw you earlier, we didn't shake hands.
Right.
We're not going to do that. Some things have changed and some things need to change. We're wearing masks, which is very important. But I think just the concern versus the fear we've got to have a balance if we're going to move forward as a society and as an economy for that matter.
You've got to be really pleased with how your hospital has performed.
You have no idea. I am just so proud. You mentioned Hospital Week. This week we have been celebrating. We've been, best thing to get to staff's heart is to feed them. So we've been feeding them regularly, and we've got them T-shirts, and I've been walking around with a smile, because as scary as this whole experience has been, and as concerning as it has been, for us to come out on the other end with the statistics I mentioned earlier, and not to have a positive patient now for a month admitted to the hospital, and we never had any COVID deaths. I couldn't be more proud of our staff. They're amazing.
How many people, and this is a question I have to ask, at the height of this first curve, how many people did y'all have in Merritt at one time suffering from COVID?
The most I believe we had at one moment with positive patients in-house was about 5. I think that's the highest that we had.
I think that's a testament to the community, that you have to think that they were doing what they were being advised to do.
Yes, I do believe that several things were contributing factors. The fact that the casinos were closed as early as they did really helped our community. While that has been negative from an economic impact, I do believe from a public health impact, that's been a big positive for us, and it did flatten this curve as they've talked about on the news. So that's been a big positive. I do believe also that our community's done a really nice job of social distancing. They've been smart. I kind of pay attention because, as an essential healthcare worker, I've been going to work every day. Matter of fact, I think I worked 55 days in a row at one point. I'm not doing it anymore, but it was rough. I did count because I was exhausted. But that's okay. We were all working very hard because we care about our community. But going to and from the hospital or just being out in the community, I realized just in the last couple of weeks, traffic's been picking up. Not just one car in the drive-through at that place that I drive by each day going home. There were 3 cars. But I know we're excited. I got to eat in a restaurant the other day right here in the community, and I was so excited to go in and eat. But I noticed, even though they have 50% capacity, even that was only about 50% full.
Gotcha.
And so it's been interesting to me that people have been much more compliant with the encouragement and the restrictions than what I thought they were going to be. But I do want to encourage everyone, please support local businesses. Our team at the hospital, we're being very wise in what we do, our leadership team, but we made a decision just this week that we're going to go out to eat together for lunch one day every week. Because we want to support our local restaurants.
And that would be a small group?
Small group, yes. Small group, very careful. I mean, we're following all the guidelines,
Good.
but we've got a responsibility to be wise, but we also have a responsibility to support each other.
You lead by example, I
Absolutely.
believe. Okay, I said no trick questions to Lori over there at Merritt. I have to ask you the trick question.
Okay.
How was the date of National Hospital Week determined?
Yeah, I'm not really sure.
You're
Lori,
a PhD.
Yeah, well, thank you, but I'm really not sure where the date comes from. Do you know?
Yeah, I just read up when I knew I was going to be
Please
talking
inform
to
me.
you.
I've been doing this 25 years. I don't know the answer.
You're going to say, duh, the birthday of Florence Nightingale.
That makes total sense.
It does, and I want to thank you for coming over here today. Do you have any closing thoughts?
No, I want to thank everybody again. The outpouring of support from the community has been amazing. We received such kind letters. I had a letter from a patient just yesterday that she had a loved one that had been admitted to our hospital, and then she was also admitted. And it's phenomenal to me that people can be so kind. And I've said multiple times that the recognition has been so much more special to our staff because they would have done all this without the recognition.
They do it every day.
They do.
Before this.
And so now that they've been recognized, I can just tell a difference in their attitudes and their mood. There's a lot of pride. We care a lot about our community. We care a lot about the city of Biloxi, the city of D'Iberville. So, I mean, we're always interested, but this has been one of our ways to very publicly give back, and it's so important to us. And
I still remember after Katrina, and I've said it to you before, there were all of these shiny stainless steel tanker trucks parked all
Yes.
around the hospital, and y'all were making preparations in case you lost water. For all I know, you did lose water for a little while, but however, you had a plan, you executed that plan to perfection.
yes, we have an amazing team. We planned, we over-planned. We actually have a set of plans of things we were going to do additional to adapt our facility or to expand our staff or do any of those things. We put them on the shelf because we never reached the point of having to implement them, but we have them all sitting there ready if we ever needed them in the future.
Tom McDougal, I want to thank you very much for making this long journey from over at Merritt over
Whole 2 blocks.
Yes, sir. Thank you. And the weather has been beautiful since
It's
this thing
wonderful.
started.
It is so wonderful. I really enjoyed it.
Well, thank you very much. We're going to turn now to the Salvation Army to get a report on what the Salvation Army has been doing throughout this crisis and what their plans are for the future. Thanks again, Tom.
Thank you.
Thank you. Joining me now is Major Bradley Caldwell of the Salvation Army of the Gulf Coast. How are you?
Greetings, good to be here.
So how has your life changed and how has the Salvation Army changed?
Well, we've had the limited activities indoors. That's been off limits for most people, but we've continued to provide food and services to people by appointment who come to us and receive that help. And we've just recently re-engaged giving showers and laundry to the homeless crowd down in Gulfport. So we've never stopped helping people throughout the pandemic, and we've been thankful to be able to keep serving, and folks have been good to support us during that time.
A lot of people want to know what's up with the Kroc Center. I know you've met with Mayor Gilich. What news do you have to give people, if any?
We're working towards engaging the fitness membership to be able to come back in 20 at a time. And we're also talking about the possibility of day camp and possibly the swimming pool. We know those are harder issues to resolve, but we're just conferring with the local authorities to see if we can manage to work out a plan for that.
You've been a lot of places around the world and you've dealt with a lot of crises. What is your advice for, look in that camera and give people your advice?
Don't be afraid to be different during these times. Wear your masks, wash your hands, keep your distance, and don't feel bad about that. I think that's being a good citizen. And actually one of the preachers I've listened to said it's loving to be compliant, to work within the guidelines, that people that are smarter than we are about science know how to help us protect ourselves.
So is this a special thing here with the badge on it, with the shield?
A certain person that I'm married to has handmade about 150 of these, and this was the particular one that she designed for me to keep me safe out there.
I want to thank you, Major, for everything you're doing, and thank you for this update.
Well, we enjoyed it. It's our heart. You know, God called us into this not to be comfortable, but to be useful.
How long have you been here now?
We've been back on the coast since 2019, but I grew up in Gulfport and graduated from Gulfport High School back in '82.
Why Gulfport? I mean, did you not know about Biloxi?
That's where my parents moved. I was too young to make a decision about our household myself. So,
I want to thank you again.
likewise, we appreciate you taking the time with us.
We leave you today in the midst of National Hospital Week with a salute to our healthcare workers.
Hello, I'm Fofo Gilich, Mayor of Biloxi. I want to take a minute to express my appreciation to all the nurses and caregivers for the selfless service you each provide every day. Through your chosen profession, you provide endless kindness and comfort. You practice and display the knowledge of life-saving skills you were trained to do, and you demonstrate your insatiable need to care for others. Your strength and compassion is recognized and admired. Thank you.